Hello, my name's Dakota. I'm going to be your nurse today. Do you mind if we have a student?
Yeah.
This is Brayden. She's a student nurse. She's going to be working with me today. To start off, I have a couple questions for you regarding Sophia here. So I was looking through your charts and it said that her symptoms started about 6 days ago. Is that correct?
That's correct.
What were some of the first symptoms you noticed?
She's just been having cough like 6 days ago, and in the last 2 to 3 days, she's just having a low-grade fever, around 101.
Okay. And have you done anything for treatments to try and help with her condition?
You okay? Okay. So we gave her Tylenol for the fever, and we also gave her some Mucinex to loosen the secretion.
Mm-hmm. Okay. Does she have any current allergies we should know about?
No, not that I know of.
Okay. Does she go to school or daycare?
She goes to our church, praise God.
All right. Is there anyone else in the family that's sick right now?
She's the first one right now.
She's the
We're
first
just concerned that, it's gonna spread out. Is that contagious though?
Yeah, so we did some lab testing and we got our results back. She has pertussis, also known as whooping cough. It's a bacterial infection. It is contagious. So currently, our plan right now is going to be to give antibiotics, some steroids to help her breathe, as well as Tylenol to help lower that fever she's got going on. And IV fluids to make sure she's not getting dehydrated.
Makes sense.
Right now she's in the early stages of pertussis, also known as the catarrhal stage. It's characterized by this coughing that you've been noticing, cold-like symptoms, so runny nose, fever. So we're gonna hopefully start that treatment here in just a little bit. Before we start any of that, we're gonna grab some vital signs on her.
Okay.
Hey, Sophia,
Yes.
do you mind if we grab your vital signs?
I'll be right here, honey. Everything's gonna be alright. Yeah, that's fine, guys.
Vitals. So we're just gonna make sure that your fever is around the same or getting better. Gonna make sure that your heart isn't working too hard. All those things. So first, this is my thermometer. I'm gonna run this across your forehead to see if you have a fever or not. Is that okay?
That's fine.
Can you do it first?
Sure. So this will just go to your armpit right here. You're just gonna measure it for your temperature, just like that. It's not gonna hurt you. See? There you go, nurse. Thank you.
All right. So are you ready?
Okay.
All right. So we're just gonna put it right there, and you'll just hold it there for a few seconds. All right. You're all good. That's a 101 degrees Fahrenheit.
Okay.
So next, this is called an O2 sat. This just gets the oxygen. It reads how much oxygen is in your blood right now.
But I'm already getting some.
We just want to make sure that you have enough. Because you're coughing and your lungs are working so hard, we want to make sure that you're doing okay with the oxygen you're getting. So you'll just put that on the tip of your finger.
But my finger isn't breathing.
No, but you have blood in your fingers, so that's how we can measure this.
Okay.
You're doing great, honey.
Respiratory rate 29. Thank you, Sophia.
You okay?
No,
Yeah.
it didn't hurt. O2 is 95. So now
Great.
we are going to get your blood pressure. So this just will go around your forearm, and we're going to make sure that your heart isn't working too hard.
My heart's working.
It's working, but you want to make sure that it's not being worked too much.
Is it going like a bracelet?
Yeah, it is going to
I
go
have
like this.
many bracelets.
Yep, so
This is a pink star.
what color is that one?
That one's purple.
All right.
I got this one off of another kid.
Is that your favorite classmate?
No.
Alright, so we're just gonna have you set your arm down while I do this, okay? So you're gonna feel some pressure, but it's
Pressure.
not gonna hurt. Yep, it's just gonna squeeze your arm, okay?
Okay.
You're doing so great, honey.
Alright.
See?
113/85.
Awesome.
And we're all done with your vital signs.
Okay. I do good.
You did
You
great.
did great.
Now you can go back to playing with your toys.
Thank you, guys.
Alrighty. We're gonna go ahead, go grab those medications,
Okay.
and we'll be back in just a little bit.
Perfect. Thank you so much. Come in. Hi.
Hello. She's asleep.
She's sleeping. Yeah.
Okay. Well, while she sleeps, I have her medication here ready to give her. I figured I should talk to you a bit about what the next couple of weeks are gonna look like for her. So pertussis usually lasts anywhere from 1 week to 3 weeks. And what you can expect is continuing symptoms of her cough and runny nose or flu-like symptoms. But you're also going to want to keep an eye out for vomiting after coughing, her really bad coughing fits. You're going to want to look out for hypoxia, which will happen when she's not getting good air. You can see some discoloration in like her mucous membranes, so like around her lips. If she starts turning blue or purple, that means she's not getting enough oxygen and you should bring her in.
Makes sense.
Yeah. Anyways.
What do you have in there?
So what we got for her, we have her erythromycin, which is her antibiotic. It's going to help take care of the pertussis.
Okay.
We have prednisone, which is a steroid to help her with her breathing. And then we also have Tylenol because she was spiking a fever when we came
Right.
in last time. And then some water to help chase it all down.
Okay. Do you want me to wake her up?
We can wake her up.
Yeah. Hey, honey. Hi. Nurse Dakota and Brayden is back. They have some medicine for you.
Hey, Sophia. So I got some medicine for you here. We're gonna start with your erythromycin. I know, big word. This is gonna help fight off the sickness that you have right now. This is gonna help make you feel better in the long run.
You'll be okay, honey. Eat it so you can see your friends again, you know?
It's grape flavored.
Oh, I like grape.
Good job.
And then, yep, not the best flavor. Here, we got some water to help chase that down. Great job. Alrighty.
Thank you.
Then this next one is Tylenol. It's going to help reduce your fever so that you aren't feeling so hot, and it'll hopefully help reduce some of that.
You've had that before back home.
Yeah.
Remember? When you had a fever? So it's just gonna be the same.
Okay.
Alright, here you go.
And then make sure that's your favorite flavor too.
Oh, great job. I know these don't taste good. Okay.
Take a sip of water.
And then
You're okay, honey.
pass me the prednisone. Alright. And this is the prednisone. This is going to help with your breathing so that you don't feel so tight in your chest. It's going to help open up your lungs. Alrighty. Yeah.
Awesome. You did great.
Okay. Good job. And then, Sophia, do do you feel like you need to rest, or do you mind if we listen to your heart and your lungs?
You can listen.
Alrighty. Did you want to go ahead and do a quick respiratory assessment?
So this is my stethoscope. So I'm gonna put this on your chest to listen to your heart and your lungs to make sure they're working good.
Is that gonna hurt? Right?
No, it's just gonna go right on your chest.
Okay.
So now I'm gonna do one right on your side right here, okay?
Okay.
So the patient is head bobbing, and her lungs sound pretty clear to auscultation bilaterally, both anteriorly and laterally. She is looking a little not well and tired.
Okay, I think
Okay.
we'll give it a listen. Did you notice any odd breath sounds when you were listening?
I didn't hear anything.
Oh, okay. I'll give her a quick listen too as well. Alrighty, one more time I'm gonna listen to you just like she did with the stethoscope.
Why two?
Because I wanna make sure that we're hearing everything you got going on in there.
Okay.
Alright. Nice deep breaths from you. Great job. And I'm gonna listen to your sides here. Okay. All right, and then do you think you could sit up for me so I can listen to your back?
Can you help me with that?
Okay. Great job.
Still like that. Right here.
Well, we want to make sure we keep that cannula on. Make sure you can breathe.
Doing a great job, Sophia. Good job breathing. Alrighty, and you can sit back down now. Alrighty, so I heard you did a good job on the visual inspection. She's definitely looking sickly. Has a little bit of that bluish type stuff going on around her lips, which is cyanosis, as we know.
We forgot to check her cap refill. So I'm just gonna pinch your finger. Thank you.
Alright. But when I was listening in, I heard what we call stridor, which is that inspiratory wheezing sound. So when she's taking her breaths, her airways are nice and tight, which is not what we don't want. So, good job though.
You did a great job.
Yeah.
And you're a good teacher.
Thank you. Alrighty, we'll be back in just a bit.
Okay.
Check on you guys
Thank
again.
you guys. I appreciate you. Come in.
Hello.
Hi.
I'm checking back in on you again. So, since we know what your diagnosis is, I went ahead and had my nursing student here do a bit of research on pertussis.
Okay.
And I'm going to have her explain some things that you should keep an eye out for going forward.
So one
You
of
can if you want to take a seat.
Perfect. So there are a few main things to keep an eye out for. The first one is called encephalopathy. So her infection is a bacterial infection, and so what happens is that it can affect the brain, and so that could cause an inflammation of the brain. And so with that, we could see increased cranial pressure, which means that she could become sluggish, just not being like her normal self. We know she is sick, but like, just like if she seems to be weirder than normal. And then with that, due to the increased pressure in her head, she could have seizures. So that would be a time to come straight into the hospital to get it checked out. The next one's pneumonia. So she could start having the crackles in her lungs, and again, just the same kind of respiratory virus going on. Next would be cracked ribs. We see that more in adolescence, so she's a little bit young to be experiencing that, but just to kind of keep an eye out, she might have some rib pain. There's a difference between like a coughing rib pain and like a broken rib pain, so if anything seems different than normal, you should definitely come in and see us.
Will.
And then the last thing would be something called subconjunctival hemorrhage, which just means she's coughing so much, it causes the blood vessels to kind of burst in her eyes, so her eyes would become red. It's typically not too serious, but again, if it does happen and you guys notice that, it would be good to come see us. Do you have any questions on those?
It all makes sense. I'll call you guys if you have any questions.
Perfect.
All right.
Thank you.
And after that, I had a few things to talk to you about in terms of immunizations.
Okay.
Looking at your chart, your last immunization for Sophia here was when she was 6 months old. Is that correct?
Yeah.
Okay. Do you have any plans to get her caught up on immunizations?
Sure. What are her immunizations to get by now? that she wants?
So I have a nice little graphic here, and this tells you how you can get caught up on your immunizations. So right now Sophia is 4 years old, so she's missing pretty much all of these immunizations in here. So we can make some plans with your provider,
That'd be great.
and we can set up some appointments, and then after she's done being sick here, we can get her through all of her immunizations.
Yeah, we'll do it.
Yeah, sounds great.
Thank you.
Awesome. Well, we'll check back in a bit.
Thank you, guys.